Pain's so funny because it's
complex.
It's complex.
Yeah.
It's like it's a defense mechanism. Like you need it. If you didn't have pain, you'd die.
Yeah, totally.
But it sucks because it hurts.
Yeah.
Nobody likes hurting.
Yeah.
So yeah, I don't know. It is very complex, and I find that too. Like in just on the weight room floor, jiu-jitsu is a contact sport, so people come in, they've got bumps, bruises, pulled muscles, whatever, and so while they may not warrant full-blown physical therapy, I do take very seriously like figuring out whether or not it is outside the scope of my practice, and if it is, I will refer out instantly. But I mean, oftentimes we find ourselves working with the exact same things in that like people be like, it hurts when I do this exercise. Okay, well, let's take all the weight off of it. Can you do a body weight? And sometimes they'll be like, yep, I can do a body weight, no problem. All right, let's do a body weight today. Let's do a body weight today. It's a tissue capacity thing, right? Other times they're like, it hurts when I get into at this depth or whatever. I'm like, okay, well, let's take some of the depth away, take some of the range of motion out. And they're like, I could do it this range of motion. All right, we can keep the weight, but we're just going to go halfway. And that's totally fine. We just do partial reps today and just kind of see where things shake out. So it is, once again, very validating to hear you say these things. It's like, I feel like we're on the right track. And it is nice to know that, the people who are coming in to see us are getting the right care, I guess you should say. Yeah.
There is a lot of problems that can be solved if people were just encouraged to move a little bit more and move properly and have a little bit of guidance. Yeah. I really believe that. And it sucks because what we see is more advice that tells people to stop moving. And I posted on my Instagram story last week that was like, I will never understand when people have gone to have already rested for months, go to a healthcare provider only to be prescribed more rest. I'm like, I always scratch my head, and it goes back to the question that you asked earlier of why that is. And as much as I don't think it's coming from a bad place, this advice, it's just more of also knowing that there's so much better evidence out there that shows that motion is actually one of the best ways to promote recovery, to come back from an injury, to actually get people back to doing the things that they like. So I don't know. I honestly truly believe, and I've said this before, that if people just started lifting weights, if jiu-jitsu athletes just started lifting weights, it would solve so many problems.
If you all don't listen to me,
listen
to Diana.
I'm like, if you just start lifting weights properly, like you could spare yourself a lot of issues.
Yep. Shameless plug. Come see us at Victory Submission Strength.
Literally. Go train with Matt.
Where is the line? Because it's a very blurry line, it seems to me, between like physical therapy and working out. Because physical therapy is just kind of working out, but while you're hurt. Yeah. And like, that's probably a very oversimplification. But,
no. I think it's great. It's the way we see it, it's a spectrum. So strength training and then, like rehab, it's just on a spectrum. We're just sliding the what is it called? The knob. Like the whatever, back and forth, right? Like if you're dealing with pain, we still have the same principles. We're trying to figure out what are some things that you can't do? What are the things that you can do? What are the things that you need to get back to? And how can we program in between? Now you just add the complexity of pain and still the same thing. What can you do? What can't you do? What you would need to do? And how we can get you there. Yeah. So it's just sliding back and forth.
In doing we had our first ACL rehab, like they had gone through physical therapy and they've been cleared to move on to like bigger things. And she came to us after maybe 6 months after having torn her ACL, MCL, and meniscus. Jess Stroll, if you've watched, she was on one of our earlier episodes. In any case, now she's a coach with us.
Oh, cool.
Yeah, she's like fully bought into the thing. What were we talking about?
I said that physical therapy is
working out.
Okay.
Okay. So because that was the first ACL I had seen. And so in my research, I went through all of like Mike Boyle's stuff. I went through, all of well, I went through like the strength coach, all the strength coach message boards, everything, like looking for as much information as I possibly could. I'm like, how do I deal with this? Like what's going on? And the thing that came back every single time was good rehab is just good training. Mm-hmm. Just like find out what they can do and then do that, mm-hmm. and then push it a little bit more and mm-hmm. see if they can do that. And then if they can't, then back it off. And like, if you just like keep that in your head, you know, obviously there are more nuanced, there are nuances to this. Like probably don't want to introduce a bunch of rotational force right away. Keep things linear for a little while and like make sure that is stable before you start moving into, you know, into other planes. But that was the thing that came back. And so that just to what you're saying here, like, there is a huge overlap, and mm-hmm. if you're both rehab and strength training, it is all very much intertwined, and the ones who are good at it are ones who are very creative and are able to like figure out what people are able to do, and then, you know, if they're not able to do it, find something else and totally just make sure you get the same training effect.
I agree with you. I think good rehab is good training, and if you understand the principles of training, then it's going to make the rehab process so much easier because it's the same stuff. Yep. And I think I have a lot of friends who are strength coaches that are excellent at rehab, you know, and then you can also say there are some PTs that are just horrible at rehab, even though that's like what we should be doing. Right. But it all goes back to really understanding the person in front of you and then understanding these basic principles. And like you mentioned, you're obviously not going to bring in rotational things at a certain time, but that's also being a good, safe, logical strength coach. Yeah. Yeah. Like if someone came in with something, it's like, oh, when rotating, it hurts me. You're not going to be like, great, let's do it. Yeah. Right. You're going to be like, wait a minute. Right. Let's build you up in the very logical process and then start to progress you properly in these areas. And that's just being a good strength coach.
Yeah. So. Yeah. How much are PTs like siloed from like strength coaches? And what I mean is like, because like what I think is happening, you go do your jiu-jitsu and you go work out and everything, and then you get hurt and you see a PT, and then you like do your rehab, and then you go out back into the world or whatever, and you're just doing your own strength program. But like it almost seems like if there's this overlap, are there gyms where it's just like strength coaches and PTs like coexisting in the same thing? Because I feel like a lot of the medical field in general is very siloed and like all that kind of stuff.
There are more and more gyms popping up that have strength coaches and PTs that actually collaborate. I have a good friend that owns a big practice out in New York City called Reload PT. They basically have strength coaches and PTs that just work together, working with all their clients. But although they don't work specifically with jiu-jitsu, they're doing it for like the general population, which is amazing. It's like the next wave of healthcare. I think that's what it's going to look like. Yeah. It's more of a collaborative effort, and then you have doctors on the side that also are very movement focused, and they're trying to get people to be more conservative with their care rather than jumping straight into surgery as like your consult. Like you just reach out to them and say, hey, I have this person, and they'll be like, cool, like we're on the same page, bring them in, do PT, and then you like have a strength coach be able to like continue with their care or overwatch their care. Yeah. So I think in jiu-jitsu though, it hasn't evolved to that point, but I think could be a direction that we're going to see things move, which is kind of cool because jiu-jitsu is obviously growing really, really fast, and the demand for care in this specific way with this specific population is also growing. So I don't know, maybe one day we'll see a gym that has PTs there, but also strength coaches that can complement each other, collaborate with each other, and then create like an environment where we're really focus on getting jiu-jitsu athletes back to training like in a safe way, and not telling them that they have to quit.
Right.
You know, so.
Yeah.
Check us out in Las Vegas, 2025. It's coming.
Oh, let's go.
Yeah, I also remembered as I was asking that you were like, hey, I have this idea to have like a PT in the gym. I was like, oh yeah.
That's it's great, and I think we bring different strengths to the situation, and it's also important to have to understand like where the other person has the strength or the other side has the strength. And most of my learning has come from not PTs, strength coaches, chiropractors, like people who have really been ingrained in the trenches of treating difficult cases and then coming out with these principles. It all comes down to principles. All the principles are the same. It's like the same things. If you hear it over and over again from some of the best, weightlifting coaches, some of the best sprinting coaches, some of the best chiropractors, physical therapists of all time, you're like, oh, they must be onto something, right? Maybe I should follow some of these principles. So I've learned a ton from people that are not deemed as like physical therapists.
Who just out of your pocket, who?
So some of my biggest influences, one, I will have to say I worked with Craig Liebenson. So Craig Liebenson is a chiropractor in LA. I started taking some of his courses, and he's very well known in the chiro space, and a lot of his teachings are straying a lot away from like the crack and pop type of treatment.
Rack 'em and crack 'em, they say. Rack 'em and crack 'em.
It's not, he rarely does that. A lot of his stuff is honestly movement based, and it's really empowering, and it's really it's really helped me frame the way that I see chronic pain, because I actually worked in his office for like a year before I decided I really need to do my own thing, and he was super supportive of that. But he was a big influence in being able to kind of teach me the base. And then one of my really good friends and mentors, the same guy who owns Reload PT in New York, Ryan Chow, he's basically took a lot of Craig's stuff and then kind of made it something where I understood it better. And he really helped me create like the framework of how I treat as a physical therapist. And then just moving forward, there's a lot of people in the world of like sprinting, like Lee Taft and like Derek Hansen, like know these guys, some of these guys, right? And then
huge names.
There's Marty Gallagher, one of the best weightlifting coaches in the world. Like these are all people who have worked with the top of the top of the top, and they all come back and tell all of us teaching these courses like the same principles. And you're like, if this is how you're treating the elite, then we should be able to take these principles and utilize it to any population, right? It doesn't matter. It doesn't have to be sprinters.
Right.
You can still use the same principles with jiu-jitsu athletes, with basketball players, with things like that, right? So.
Yeah. Very cool.
I was going to ask, because I have a couple people who come to mind who I won't name on camera, who are...
He stares straight into the camera.
Well, I won't name on camera. But they're like frequently injured. And not you, but there's like some people who like just are like frequently injured. I don't know why that is. It's like people are getting injured more than other people, and it's like very clear. And I don't know if anybody has the answer to this. I don't know if you have the answer to this, but why is this? Why are people getting hurt way more than other people?
That's pretty complex. It's like I think when we talk about risk factors, there's a lot of different things we have to keep in mind. So one, medical history is huge. If you have had a previous injury, that is a predictor of another injury in that same spot. Like, for example, I've sprained my ankles like 6 million times when I was younger playing basketball. So now I'm just more prone to ankle injuries. I have to be very mindful of volume management, intensity management, like sleep, and making sure I'm not too fatigued. Like these are all things I have to be mindful of. That way I can put myself in a situation where I don't get injured. And then on top of that, it's like the second reason why a lot of people get injured is maybe their lifestyle things are not where they should be. So we talk about this a lot, is one of the best ways to reduce risk of injury is to make sure that everything that you're doing off the mats is good, right? So you look at the research and they're saying like getting enough sleep, getting enough recovery. It's not just about the hours that you sleep, but it's the quality that you sleep. Making sure that you are fueling properly when you're at home. You're not just eating junk food and all these things that are not giving your body the energy that you need to be able to train properly. Hydrating properly. And then also the biggest thing, and maybe going back to your first question of the biggest challenge working with jiu-jitsu, is how do we manage your volume intensity on the mats and also off the mats? Like this is the biggest challenge, because most people are like, I can just train hard every day. But what we know is your body has a limit. same thing as when you're working, is that your body will have a limit to how much you can put yourself to work. And then it's going to give you signs that it needs to rest, or else it's going to force you to rest. So most people that we see that are constantly injured, they're not actually giving their body enough time in recovery in between sessions, or they're just hitting it too hard all the time. They're not really tapering down. Like, you don't have to go balls to the wall every day. You can have a super hard day, and then the next day you're like, oh, I'm just gonna roll a couple people, maybe flow and not really go as intense. Like, as you get better at jiu-jitsu, you get a better idea of turning up and down your knob of intensity. And I think that is something that we really have to discuss with people, because if you're constantly putting your body into a super high stress environment, it's going to, one, get fatigued, and then over a long period of time, your body's not going to be as robust. You're going to have that chronic fatigue, and you're going to not be able to function as well as you need to. So that's also something that we talk about, is a big part of it, of why people are always injured. And then another part of it is, I think, if people have previous injuries that they never fully rehab, and they just keep like pushing it and pushing it and pushing it, you know. And
that's what happened to my shoulder.
But it's like one of those also one of those things where jiu-jitsu obviously is a contact sport and is something where it's hard on the body. So we have to decide what aches and pains are worth it. Right. You're not going to be walking into the gym every day, I feel pristine and I feel perfectly fine.
Right.
Yeah. It's like, oh, my shoulder's feeling a little achy today, but you know, I can work through it. Or my knee's feeling a little funky today, I can work through it. Right. You're not going to be, oh, I feel super, super good all the time. So you just have to pick your battles, I guess.
Yeah.
I think like there's one of the athletes that we train and who Josh and I have trained with, he often says, my worst enemy is my memory, because I feel like I'm 20, but I'm not 20 anymore. And I need to temper that expectation that I'm going to be able to do everything that I was able to do now. And it's something that in my 30s, I feel, anecdotally speaking, am learning still, is like, how do I manage all of this? Like, these are not conversations that I had to have with myself in my 20s, where I could just like go balls to the wall, as you so eloquently mentioned, all the time. Excuse me, all the time.
You're
and
so old.
And so now in my 30s, I am finding myself having that conversation more and more. And I like, as I wake up, I'm like, how do I feel today? Can I like push, or do I need to like scale back? And
I really hate it when you wake up and you're like, man, I can't train today.
That's happened one time.
It happened once.
It happened one time.
Just holding it over your head.
It happened one time. I had a sprained MCL and I didn't sleep. So you know what? I took the morning off.
That's fair.
I'm glad you did, actually. No.
Speaking to longevity, I think that is a really important point.
Yeah.
Is if you really want to, and I think nowadays jiu-jitsu has changed a bit as it's evolved to not be, oh, I need to just, go as hard as I can for a short amount of time. It's more of, how can I actually
Pohada responsibly
all the time. Yeah. If you Pohada responsibly.
It is a shirt?
I have a shirt. I was going to bring you guys shirts, and then I was in a rush yesterday, and then also my flight got delayed 3 hours, and I was like, I had time to pack the shirts. I didn't have to rush. But I'll mail you guys some stuff.
That's amazing.
We have a shirt that says Pohada responsibly, and then we also have rash guards. I'm going to send you guys some rash guards.
Oh, yeah.
Thanks, Diana.
But yeah, going back to the longevity thing, like that's a conversation we have a lot. Most of the people that come to us aren't really like, how can I get back to mats immediately so I could just, it's not about that. They just say, how can I train for a really long time? And then it's like, great, I'm glad you asked, right? One of the most important things is to be able to know where you are in life. Know that you are not 20 years old where you can just like put your body through the ringer and expect it to bounce back quickly. We age, we're humans, and so you have to have that conversation with yourself. How do I feel today? How did I train yesterday? Okay, if that's the case, then what do I want to do today? And then just knowing that you can ramp it up but bring it back down. There's peaks and valleys to everything, and you just can't always stay in the peak.
Yeah.
And if you just go back to the most basic things of weightlifting, you can't RP, you can't like have a
you can go 10 out of 10 all the time.
Yeah, 10 out of 10 every single day, RP 10.
Right. Yeah.
Just like
just crush yourself.
Yeah, just kill. You're just gonna like basically run your body into the ground.
Yeah. Speaking of going really hard and being old, I'm old too.
The hell, you look at me when you say that. I don't know. I'm 34. I'm not that old.
We're basically the same age.
Haven't even hit your prime yet. You're still there. You're still on the climb.
Shit. All right, continue.
I'm in the same division as you. I'm in the same age division. Okay.
Master one. Let's go. Me too.
Let's go. So okay. Yeah. Speaking of going hard and starting to get old, we're not in our 20s anymore. That's what I'm getting at.
Yep.
Yes.
Performance enhancers. When people come to you, do you ever be like, "Hey, bro, just get on some TRT, or some BPC"?
Yeah, that is a kind of, I guess, a little out of my scope of what I would recommend. I have heard from people that, for men, especially like after a certain age, then your testosterone naturally goes down. There are benefits to, TRT and stuff like that. But that is definitely something, if people come to me and ask me, then I would have refer them out.
That was my question is like, do you work with like, what do they call them now?
Enhanced athletes?
No.
Like doctors that
but they have, what do they?
I don't know where you're going with that.
Like revitalization, vitality clinics. What do they call them? Like there's like all these clinics popping up now, which are specifically for like these types of things. I didn't know if in like the physical therapy world, if there's like, in the same way that physical therapists and strength coaches might be working closely together, if there's also
I feel like that's still relatively new. I'm sure there's clinics out there that have PTs that work with them, that have like, I don't even know what you would call them, those doctors that prescribe that kind of stuff.
I was just talking with one, Dr. Lee Howard. I think they call them like vitality clinics. I gotta look that up. Matt's gonna put it on the screen.
Yeah. Josh. But I mean, I think it would make sense, right? Especially if you're working with like masters athletes.
Yeah.
That want to continue to perform at a certain level. So I mean that's definitely out of, like, we don't really work with them specifically. Maybe one day, it's always like a possibility to just help people get back on track. And I've heard people anecdotally say like getting on TRT has helped with their joint health and all these things and stuff. But yeah.
Got it. So you have worked with athletes though who are like
on TRT,
who are on it?
Yeah.
Okay, got it.
Yeah, so I have before. Some of our old clients have, and for different reasons and stuff. And I always try to monitor, because you don't want to put too many factors onto when you're working in a program, because then you don't know what's really working.
Yeah.
So we try one thing for a while, and then if, let's say, we're kind of like smooth sailing, we're kind of making our progress, and add something else in. Just want to make sure that we don't have too many things contributing to.
Yeah, you don't know what's like helping and
what's actually helping them.
Right,
Same thing with like when you're programming anything for rehab or strength training, right? You don't want to change too many factors at one time, because then you don't know what actually was the thing that made the change.
Right.
You want to stick to something for a period of time, and then once you're like, okay, cool, I've seen the effects of it, then you can start to adjust other things. Yeah.
We talk to members about that all the time. They'll, when people first start with us, they're so used to like, I strength train 5 days a week. I'm like, well, let's just try 2 for now, and let's see how that works. And they're like, okay, well, can I do my own thing when I'm not here? And I'm like, let's not for right now, at least.
You could, but it makes it hard to like.
You could, but it makes it hard to know where you're getting results or why you're getting certain results. And the other thing that the analogy that we use is like, training is it's a recipe, not a menu, right? You can't just like pick things willy nilly. Because if you do, you just don't know where the results are coming from. So yeah, that makes sense.
Yeah. I know you have the hot takes open. I was gonna ask.
Well, no, I was just preemptively opening.
You just have it open.
It's just
hot
open.
Takes.
Yeah.
That was a signal.
I love a good hot
take.
take.
It was not a signal.
Not a signal.
We'll get to the hot takes.
I love a good.
You're gonna have to wait a little bit longer.
No, yeah.
I don't know how much longer, but
Matt's gonna put the time up on the screen.
I'm not gonna put the time up.
I do agree with you a lot about making sure that you have that communication. The transparency that you have with your clients is going to be a part of the foundation of the relationship that you build moving forward with trust too. Yeah. So I think that's something that we need to talk about with just working people to people type of services is there needs to be an understanding that I'm really not trying to hold you back.
Yeah.
We need to maximize your time and maximize your progress, but we have to make sure we structure in a way that makes sense. And then once you explain it to them, they're like, oh yeah, that makes a lot of sense. Yeah. And you're like, great. Yeah. And then you kind of just keep going. Yeah. Right.
I'm curious to know if you also see or hear similar things in that, like people wanting to do more than maybe they need to.
Always.
Yeah.
Always. And especially when I clear them to go back to some sort of jujitsu. Can I do this? Can I do that? I'm like, I promise you, I'm not trying to limit you from doing what you want to do. But you have to realize this whole situation, just because you feel better doesn't mean we can just clear you to do everything.
Right.
And my job and in terms of if we're speaking on longevity, my job is to get you back to jiu-jitsu as quickly as possible, but as safely as possible.
Right.
Safety is our number one concern.
Yeah.
And they're always like, huh, okay, that makes a lot of sense, right? Like, I don't want you to get hurt again. That is like the bottom of
do no harm.
Yeah, do no harm. Like, I really don't want you to get hurt, and this is the way that we need to do it.
Yeah.
And if you listen to me, then we'll be able to make more progress. And I've worked with people who are a little stubborn and they'll kind of push it a bit, but the way I try to explain to them is this could be something that we can resolve in 2 months.
Yeah.
But if you keep doing what you're doing, it's going to take 6 months.
Right.
Like, if we look in the future 6 months from now, where do you want to be? And they typically kind of come to their own realization of, yeah, you're right. Like, maybe I will. And then, of course, they kind of listen. And 2 months later, we're really able to resolve it. And they're back to training when we don't have to waste all that time.
Right.